I'm here to talk about complex regional pain syndrome, or CRPS. The old name used to be RSD, reflex sympathetic dystrophy. It's actually a rare condition with fewer than 200,000 cases in the United States. It's a chronic pain condition, usually after trauma, surgery, an injury, bad surgery, gone wrong. And I'm here to talk about it because I've been treating so much of it very successfully. There are a few clinics in the United States that actually focus on this condition. What I have come up with is a really unique protocol. I take the patient once they're diagnosed with complex regional pain syndrome, and I really treat the patient as a whole. Most often, it's either in the hand or the foot. We have seen several this year in the foot. What happens to the limb? It gets hot, red, swollen, inflamed. The pain is so bad. The patient can't sleep. They can't walk. The pain is throbbing and burning. I wanted to talk about this condition because there really is hope. I have a unique protocol that I use here in this clinic that once again treats the body as a whole. I utilize food as medicine. We stop the inflammatory foods. There are many of them that cause inflammation, even the nightshades. The second thing I do is I look at the patient and see what labs they have that are abnormal. Those labs need to become normal through cellular homeostasis. So I work directly with the rheumatologist, the endocrinologist, or the primary care physician on what we can do to improve your labs. And then from a physical therapy and rehabilitation perspective, I prescribe a list of exercises and modalities that are indicated for someone with complex regional pain syndrome. We do sensory bombardment therapies where we are taking sensory brushes or bristles or a loofah and we're scraping the skin ever so gently to realign the nerves and reset the nerve pathway in the brain. I use hot therapies, sometimes cold therapies, and I use my ever so important hands. My hands help to mobilize the tissue, remove the fluid that's stuck in the limbs and in the nooks and crannies of our hands and feet. That's vital. The physical therapist touch alone and manual mobilization alone helps to improve CRPS by 50%. You must seek a physical therapist who knows and specializes in this condition, and there is help out there. I wanted you to know laser therapy is also an adjunctive therapy we use here with someone with complex regional pain. The laser is really important, and it helps to dilate the vessels that have been constricted and the nerves that are tightened and constricted. We also use different types of bands and exercises to keep the limb moving. So please know, complex regional pain syndrome is definitely something you can treat and improve dramatically the lives of these patients. Thank you for listening.